My name is Tammy Neiden, and I am the chair of NAMI Iowa's Children's Mental Health Committee. We're trying to help parents because a lot of us have reached out to NAMI because we know NAMI's name, National Alliance of Mental Illness, but most of the support groups have historically been for adults, and so there are parents there but with adult children. And so I've had so many parents tell me, those meetings are great, and I know I'm going to need them in 15 or 10 years, but I need to talk about elementary school and IEPs, things like that. We've started a system of support online, and we're trying to help people network with each other locally to start support groups. But mainly what our committee is about is advocacy, just trying to reduce stigma, let people know our story, and try to make change, because you feel pretty helpless when you can't help your kid, and there's not a whole lot we can do right now. We're trying so many different med combinations and therapies and so forth, and we go great for a while, and then all of a sudden things aren't okay for a while. They cycle. You can do something about policy. You can do something to help kids in the future, and it gives you just a little sense of control of your world, which is really chaotic. So it's odd to say, but in a way, for many of us, advocacy is very therapeutic. You want to help your kids, and it's something you can do. And the funny thing is, there's a lot of agreement on these things by different stakeholders in that. Everyone agrees we need more providers, we need more capacity in Iowa, all the way from child psychiatrists to respite workers, therapists, psychiatric nurse practitioners that specialize with children. I mean, everything. We just don't have enough providers. So as we were saying, even if people get the children's mental health waiver, they sometimes can't locate any services in their area, and that's not uncommon. We need crisis mobile units. There are some in some cities in the state, but I'm in Iowa City, we don't have one. So when a family is dealing with a child who is becoming violent or is having psychosis or needs to be de-escalated in some way, the only option is to call the police, and that's not always appropriate. I mean, and often it's just going to escalate everything higher. Having trained professionals come to your home and calm them down and assess the situation, it's such a useful thing, and it can cut down on mental illness is the funny thing, because it's almost like it's catchy. A lot of siblings, a lot of parents end up with post-traumatic stress disorder from things that are happening in the home because of that one child's mental illness. And so it can prevent a lot of those crises. Also, I think the statistic is something like 70% of police calls have a mental illness component. And I've actually I was talking to a police officer because I wanted to send them some of our materials for their state conference, and I asked if he thought anyone would be interested, and oh yes. I mean, think about how difficult this makes the job for police. This isn't what they signed up for, this isn't what they're trained for, and it really puts them in danger, because typically they're trained in how neurotypical humans react, not how somebody who is mentally ill will react. People get hurt because the police make a mistake in thinking of knowing what's going on, but it really shouldn't be the job of the police to come de-escalate a child. There should be something. We need schools. That's a big thing. I think for many of us, schools they make everything worse. And I don't mean the schools are doing things to make things worse. I mean that the school situations that our kids find themselves in aggravate their symptoms. And again, it's not fair to expect teachers to be trained to deal with severe mental illness. They're not equipped. we expect teachers to be everything now, social workers, psychiatrists, you know, we put way too much on them. And what I find we're bumping up against, and it's interesting because it seems like sometimes policy just can be one extreme or the other. It's hard to have a reasoned position. It's really great, and I'm all for it, that we have an inclusion model, that we want to do everything we can to have the most inclusive environment for our children. But FAPE laws are for free and appropriate public education. And there are some kids who cannot handle it. It makes their symptoms worse. And I know of one, but recently I heard there's another one. I do know Council Bluffs has a therapeutic school. I want to be careful, that phrase therapeutic school is thrown around a lot, but a lot of times they're military schools, they're not trained, they're not therapeutic at all. They're just basically thinking they can discipline. And maybe for some behavior problems that works, but it doesn't work for mental illness. I do know in Council Bluffs there's a school. I feel like if my son had that, because most of our problems... But there's just one in Iowa. Yeah, and it's like 5 hours away from us. Again, it's hard to get information, as we were talking about earlier today. Even from, you know, I'm starting to be on other committees and talk to people who have been working on this stuff for a while, and even talking to legislators and so forth in the DHS. It's hard to get answers. It's almost like nobody knows what the system is. And the last people you can ask are doctors. One thing that we would like to see happen is some standardization in the medical practice in Iowa, that not only would there be standard screening during wellness exams for mental illness, as well as for school physicals and so forth, but also that a standard that when a doctor delivers a diagnosis to you of a mental illness, they have something to hand you about local resources. Because all of our medical providers have been shocked to learn what I've been learning through this advocacy and bring back to them. They really think you just call up DHS and you get these services, and they really don't know what the waiting lists are for the other therapies. And some of our kiddos need occupational therapy, speech therapy, cognitive behavioral therapy, music or art therapy, social skills. I mean, there have been years where I've had 5 weekly appointments for my son, you know, or a couple years. And it's really hard because you never know what is making a difference. But you just have to go with evidence-based practices that look at the statistics and long-term and hope that it's going to work for your kiddo. When I think about the money that gets poured into campaigns and that could have totally got rid of all the waiting lists in Iowa. And I think that's what we have to do. We have to think long-term. This isn't going to be solved overnight. I know that. I'm impatient because my son is becoming a young man. I'm impatient, but I understand a lot of these are long-term. We have to think long-term. We can do some things in the meantime, like have some kind of standard training for all pediatricians and all family practitioners in Iowa, because they're usually, and nurse practitioners, because they're usually the first person. A lot of kids will never see a pediatrician in Iowa because they're in a small town and they go to the family doctor. My child has Tourette's, and I have been astounded by how many medical professionals I've talked to who have very big misconceptions about it. By the way, the CDC has free training for health professionals on Tourette's, so I hope they continue to have the funding to keep doing that. I always tell doctors, therapists, and so forth. I wouldn't wish this on anybody. Most families are from Earth and ours is from Jupiter, and I'm tired of hanging out with Earthlings. The ones from Jupiter are just so much more comfortable being around now, and I'm like, that's true because when I'm around the Earthlings, they often complain about the most mundane things and can be petty, and I'm not saying I haven't been like that, but when you live with this, and it's a child especially, because what could a child have done to bring this upon themselves? None of that seems important. Many people, as soon as mental illness is brought up, especially with children, they get so uncomfortable they can't talk about it. And sometimes it's just because they want to say the right thing and they don't want to say the wrong thing and they don't know what to say. And I would tell them, say what you would tell to a parent who has a child with physical illness, because it's a brain illness, it's physical, with behavioral and emotional manifestations. You know, bring them a casserole, go talk to them, offer to be support when they need it. They're just human beings, and problems are problems. Sometimes I have friends, and it annoys me, and I keep trying to correct them, who say, oh, I can't tell you about this, it's nothing compared to what you're going through. And I'm like, please do. It's nice to help someone else. You know, it's nice to be like the one who can listen. And so, you know, mental illness is just something that happens. It's part of life. It has always been part of human life. Some societies have done much better at handling it. Some Native American cultures have really done nice jobs of actually honoring it and things like this. I think one important message, and this is true of all disabilities, is they're all context dependent. A lot of my son's disabilities would not have been disabilities if we lived in an agrarian society where he wasn't expected to sit still inside, where he was expected to do a lot of physical things outside all the time. Not everything, but the things that he has would have just been quirky. You see what I'm saying? They wouldn't be so aggravated by so many things. A lot of these kids, what they really need is the right environment. And that's where the proper school would make a big difference. They need a therapeutic environment, they need a trauma-based environment. The behavior model just doesn't make sense for a lot of these kids.